today's world. I am Sharon Hills here at Black Talk Back, and we are here to discuss racial and ethnic disparities. Health disparities are inequalities that exist when members of certain groups does not have the same health status as members of other groups. We have these young ladies here to discuss the 9 positions of the American College of Physicians and how HIV/AIDS access, cost, quality, and how the ACA directly relates to these disparities. Jasmine's going to start with the ACA.
All right, good morning. I'm going to talk about the ACA and the health disparities and how they relate to each other, but to kind of jump into it, we're going to give you a little definition of the health disparities. According to the Institute of Medicine, they define disparities as racial or ethnic differences in the quality of health care that are not due to access-related factors or clinical needs, preferences, and appropriateness of interventions, meaning the severity of someone's illness doesn't really factor into access they need for the insurance and stuff like that. It basically deals with the stigmas that lies within each race. They have their own stigmas about going to the doctor and receiving health care and such and forth. So kind of before the ACA, minorities have less access to health care than whites. It kind of goes back to those stigmas, like in the Black community, there were some stigmas about, going to the doctor, trusting the doctor, really like going back to like the Jim Crow, where they really didn't trust the white man. So they think they going to the doctor, that white doctor may do something to them. So they really had that stigma that kind of leads them not to go to the doctor too much. Native Americans and Native Alaskans are more often lack prenatal care in their first trimester of pregnancy, and this kind of deals with the culture. And basically in Native American cultures, some cultures believe that the woman should stay in the house and shouldn't really have no access to the outside world, shouldn't take anything in her first trimester. And it all goes back to the different cultures and such. And an individual's health status is influenced not only by the healthcare system, but also environmental, genetic, and social determinants. Just like I go back to the environmental, like Southern people, they are at more high risk of diabetes and high cholesterol, certain with the foods that they eat. But some of these people have low income families who don't have access to the nutritional needs that they need to become healthy and stuff, so they have to get what's available to them. So by this, they're at high risk of these certain diseases and stuff, and aren't able to get the treatment that they need, the proper treatment that they need. And even with the whole ACA, with the new Obamacare, and to make it healthcare more affordable, there's still stigma of like, okay, do I really need to go to the doctor? With the whole, King versus Burwell, with the King, they didn't want to pay because it's like, okay, what if I don't get sick? Do I still need to come out of pocket? And some people still believe that, so they won't go to the doctor and use health insurance and stuff.
And you know what? I find that crazy because everybody needs to go to the doctor. And if they have these things like affordable health care, Obamacare, that will help them, like I feel like they really need to go. Like it's no excuse for that at all.
That's true, especially for preventative health care.
Yeah, but some people like, well, if I'm not getting sick in this year, am I gonna get my money back? If I don't get my money back, then what's the need of me spending something? If I'm gonna get sick, okay, I'm gonna come out of pocket and pay it. But if I'm not getting sick no time soon, then why pay for that? And so it's kind of like car insurance. How they be like, well, shit, I haven't gotten into no wreck, so what I'm gonna pay for car insurance for? But I mean, what is or what if? You don't know. You live life day to day, so you don't know what will happen to you. So you really can't think like that. But can't change how people react to certain things. And the sources of racial and ethnic healthcare disparities include differences in, like I said, the geography, like rural areas versus urban areas. The people in rural areas may not have transportation to get to these grocery stores or these health places, so they don't have to do what they can do, like go to a convenience store and get snacks versus going to the grocery store and traveling to get the apples and stuff they need to become healthy. Some other is lack of access to adequate health coverage, and that's basically going back to like the insurance and stuff like that. Like those that don't have insurance but have like community health care places they can go to get access, they may think that it's not up to par versus going to somewhere where somebody's paying like high premiums for these doctors and such. But yeah, gonna wrap it up and going back to Sharon.
That was very good, Jasmine. I'm with you. Like a lot of people think that I really don't need insurance if I'm not going to get sick, but it's always good to have that as a safety net.
Exactly. And Sharon, just to piggyback off of what Jasmine was saying, as far as having access to healthcare and like paying for it and the quality that you receive, members of like the minority community, they tend to be like socioeconomically disadvantaged because they don't always have good jobs or college educations and can't afford healthcare and things like that. So they make up the majority of the population who are underinsured and uninsured. So this is where access, cost, and quality come into play. And especially for minorities, like not just African Americans, like Hispanics and people of those cultures. Many of them can't afford health care, and because they can't afford health care, they don't always receive the best quality of care. Like she said, when mostly in like urban communities and things like that, they have community health centers and things. People don't always go to the hospital, So in the community health centers, they're the ones who are responsible for, or who treat most of the people that are underinsured and uninsured. So yeah, like that goes into play with access as well, like they don't always have access to the best care, and then the quality is down and they can't afford to pay for healthcare and things like that. Like community health centers are federally funded, and they're set up to serve people who don't have insurance.
You were saying that their access is low and they tend to go to the community health centers
instead of going to a hospital.
Yeah, and that can tie into quality too, because I know those community health centers be overcrowded.
Yeah,
there be a lot of people
wait
in
times
there.
are long,
and actually coming back to be seen is hard too, because it's like they have long waiting lists, and then they're like,
or not even that, they just might be scared of
Yeah.
their results or anything. Like, because I know me personally, if I take a test, I'm not gonna come back to get the results just because I'm so scared.
That's HIV/AIDS.
No, I mean, but it all ties in though. You see what
No,
I'm
I'm talking about me. I ain't saying nothing.
Oh,
about that. I'm
okay.
saying like if I take a test or anything.
Like bougie black people on here, because I was gonna say like.
No, we couldn't have
personal experience. Like, I had my mom's insurance, like when I got pregnant with my son, and then my aunt, she's like, on like government assistance and stuff like that. So she filled out my application for like Medicaid and food stamps and things like that. And then when she did that, I no longer went to my primary care physician. I started going to the community health center. And when you go there, it's different. Like you said, the quality of care is different. You're not seen as fast. Like if you go to a hospital, sometimes even the way you get your ultrasounds and things like that were different, And the type of people you see there are different than the type of people you would see in a hospital or like a more upscale healthcare facility and things like that. And as far as when how when you go to the hospital or to the emergency room and the people come in. To get your ID and stuff, find out how you're going to pay and things like that. At a community health center, you don't go through that. They just automatically, most people there have Medicaid. They don't have private insurance or things like that. Everybody is like,
I think what you say about how they treat people differently is because of that, because they don't know how they're going to get paid.
It's because of socioeconomic status. Like, if you're, not upper class or middle class, you're gonna receive care like you're lower class, So I mean, it's not fair, but it's honest. It happens, and
So basically, like for example, would you say if maybe like a 16-year-old black girl was to go into, I don't know, maybe like in doctor's office where there's like more middle to upper class people, you would think they would automatically assume that she has Medicaid, or would you think that they'll be like, okay, well let's ask to see what she has?
They're gonna ask.
Yeah.
They're gonna ask.
Just
They're
like
gonna
Dr. Cole
ask,
said.
but as far as like appearance goes, like
Mhm.
if she was white, they would probably assume that she had private insurance,
Mhm.
But if like I walk up there 16 and pregnant, they're gonna automatically be like, okay, she's on Medicaid, and that's a racial disparity just based on appearance. So yeah, I mean, like I said, it's not fair, but it's true. It's fact.
Mm-hmm.
That
Yeah,
is true.
and that's very unfortunate. Very, very unfortunate. Next we have Rakira, and she is going to talk about HIV and AIDS and racial disparities.
Hello, y'all. Well, like all chronic illnesses, how a person is treated may occur by gender, race, education, income, or the disability itself. For African Americans, we struggle more with the social light of healthcare, like poverty, unequal access to healthcare, lack of education, stigma, and also racism. These are all linked into racial disparities. Black Americans, whether you're a black woman, black guy, male, bisexual, gay, youth, we have been highly affected with HIV since the beginning. This has gotten deeper with the time. African Americans have more HIV infections and deaths.
Than any other group, really,
Right.
statistically.
Right, and that's really sad because to me it seems like blacks, we always get something the most. Like we are the leading cause, and that is really.
And to be a minority group, that's kind of sad because it's like, we make up only 10% of the population, but yet we're the leading cause of everything.
Right, and that's really sad. But today there are 1.1 million people that are living with HIV in the U.S., including more than 500,000 who are black.
But then you kind of think about it, like if it's just 10% of black people versus all the other people, like, because you got to think about it. A lot of them statistics and stuff like that they get from the places where black people only go to, like the community health clinic. They not going to the private care doctors and stuff like that. So it's kind of biased a little bit because if you think about it, if it's 10% black people, why are we the leading case?
Mm-hmm.
And so you got to really think about it.
But
like,
a lot of things, that's where access comes into play too. And that's just a small percentage. That's the ones they have reported. It's a lot of people that are living with it that don't know they have it because they won't go, get tested and things like that. Or, for instance, they like get in there. A lot of minorities or blacks don't have cars, or they won't take the bus to go to the doctor. They don't feel like it's as important, So, and like I said, with the whole testing thing, I would get tested. Like I have no problem for results, but as far as getting the results, it's like so scary. I know it is. It's nerve-wracking. It is. So,
and a lot of people are kind of embarrassed to even be seen as that to be tested.
Right.
Yeah. Right. Because of the negative,
Well, the rate of new HIV infections are among, of course, black adults. That was nearly more than 8 times than white, and twice as more than Latinos in 2010. Black men are the highest of any group. Then you have the Latino men, and then you have, of course, us black women. HIV is the 5th leading cause of death for black men and the 7th for black women between the ages of 25 and 44. I believe more should be done. What you guys think?
I do.
More should be done. I feel like making sure people with chronic illnesses have resources, prevention programs, targeting the black gay men to improve the care. Help expand education and awareness to lower the stigma of discrimination. And lastly, I just feel like healthcare for millions of Americans with HIV, it can help prevent the spread. Like, I just feel like this would be the best thing. And I also feel like this is what people need, and this is what people deserve. This is kind of random, but not so random. I read an article that said, they were thinking about passing a law to have HIV positive people like have it tattooed on them.
Yeah.
Oh wow.
Above their private area.
Yeah, so other people will be aware, like a
Tattoo?
awareness.
Oh,
I
I
feel
feel
like
that too.
I think that's
Like
a little
a
But
controversial.
that's controversial because isn't
Yeah.
like
That's
I feel like it's
religiously
kinda
you
invasion of
can't
privacy.
you
Yeah.
can't get tattoos. Isn't that in the Bible?
Well, I
Yeah.
know, but you
You
should
should've
still
marked
get
it, right?
tattoos.
No,
I got a
that's
couple,
too
but
much. That's too much.
I wouldn't do that now. That's a little
that's
extreme.
that-
but
that's valid.
but like I said, more of the prevention programs and stuff like that. I think that'll help.
But I feel like there's a lot of prevention. They have the Wrap It Up, and they just have a lot of stuff that's out there to help
people
prevent
not
the spread.
taking-
But people just not willing to accept the help,
Right.
Because
That's true.
they so scared to be like, oh, I got HIV. I don't want nobody to know.
Right.
But it's like people need to know this.
Right.
They need
Because
to
you're
know.
putting other people's life in danger
Right,
if they don't know.
right. And if they love you, they'll stick by your side.
But then again, it's people who don't want to use condoms either.
Yeah, they
But see, and that's another thing. We can't prevent that. That's all within the person. If you don't want to use condoms, then that's you putting yourself at risk. There's no prevention program. There's nothing nobody can do but to stop that. But you. And Melandria, she's going to discuss the 9 positions of the American College of Physicians.
Okay, position number 1, providing all legal residents with affordable health care. Position number 2, all patients regarding their health, their race, their gender, their age would deserve high quality health care. Number 3, as our society, we should become racially and ethnically diverse. Our professionals need to acknowledge the culturally diverse of our patients. Number 4, our patients, our physicians, and other healthcare professionals must be sensitive to our diversity and our cultures, and shouldn't be preconceived perceptions of our patients, because sometimes when that happens, they kind of look over those patients. Number 5, the healthcare should deliver systems to ensure a patient-centered medical care for the racially and ethnic minorities. Number 6, the diverse healthcare workforce should be more representative of the patients. They should have more physicians that look just like the patients, Black, Hispanic, Latino, same thing, Chinese, Asian. This will promote the understanding among physicians and other healthcare professionals and patients. Also, the medical and other healthcare professionals should become more acknowledge of the diversity by taking classes that will promote more education and more knowledge on what their culture is about. C, the medical schools should increase the efforts to recruit and maintain the minority faculty. D, efforts should be made to hire and promote minorities in leadership positions. E, funding should be continued and increase the programs that work to increase the number of physicians and other healthcare professionals in minority communities. Position number 7, social determinants of health are a significant source of health disparities among racial and ethnic minorities. Position 8, the efforts must be made to reduce the effect of environmental stressors that threaten the harm of the health and well-being of racial and ethnic communities. And number 9, more research and data collection related to racial and ethnic health disparities and needed to empower stakeholders to better understand and address the problems of disparities. And that's it.